Now we have a GMA
Yep.
health alert. A new report out overnight revealing alcohol-related deaths are on the rise, especially for young women. Our chief medical correspondent, Dr. Narula, is going to break this down. This is really alarming.
It is. And Robin, we know excessive alcohol use is associated with a lot of risks. Increased risks of cancer, gastrointestinal cancers, liver cancer, breast cancer, also liver disease, cardiovascular disease, heart failure, arrhythmias, and death. Hypertension, exactly. And so CDC estimates are that it's responsible for about 488 deaths per day in this country. So this report was a CDC report that looked at the overall deaths from alcohol for a big time span, 1999 to 2024. And they found that alcohol-related deaths went up in that time frame by about 89%. There was a big spike around the COVID years, and actually the highest year that had deaths was 2021, 55,000 deaths in that year from alcohol. When they looked at a breakdown a little bit further, they saw that American Indians and Alaska Natives were mostly affected, as were the age groups of 25 to 34, particularly women, whose rates went up by about 255% over that time, and men 188%. In terms of states, there were differences. So New Mexico and Mississippi had the highest rates. Maryland, Pennsylvania, and Hawaii had the lowest rates. And in terms of what was causing the deaths for women, it was really alcoholic-related liver disease, and for both genders, behavioral and mental health disorders.
Oh my goodness, this is a very extensive study and
Yes,
for a long
time.
period of time. How do you know if you have an issue? I know we talk about this a lot, the amount of alcohol, but how do you know, and what should you do?
Yeah, so alcohol use disorder is really considered a chronic disease. It can range from mild to severe, and essentially it's the inability to limit alcohol despite the fact that you're having physical and psychological consequences. So some of the signs you can think about is that you're drinking more and for longer than you intend. You try to cut down, but you can't. You're drinking despite having interactions or interference with your activities, your work, your relationships, despite the fact that it might be making you feel anxious or depressed. You have loved ones coming to you, talking to you about your drinking. You're thinking about it all the time. These are some of the things to consider that might be warning signs. And in terms of steps to take, certainly setting a limit on your daily and weekly alcohol intake can be helpful. Talking to a physician, there are 3 FDA-approved medications, there are support groups, there's counseling, so there is treatment, but obviously the first key is really recognizing that this is going on. And I think we don't often think about death as associated with alcohol, but so important, particularly for women, to pay attention.
Really, all right. As always, Dr. Narula, thank you very much. I hope people are really listening to this. Thank you.